Hello, my name is Gallagher. I'm a plastic and reconstructive surgeon with a special interest in gender affirmation surgery. So this video came from a question asked by a patient. They're asking, do I offer the inverted T procedure drain-free? So the short answer is yes, I do, but I will make this pretty strong statement. I have never, and I don't anticipate ever, using the inverted T procedure, and let me explain why. It's really, in my eyes, not a good option for transmasculine patients. So the inverted T procedure, or sometimes it's the anchor procedure, is known in medical literature as the Wise pattern, and Dr. Wise actually is rumored to have designed it from studying bras. So what it's designed to do in feminine patients is to reduce the size of the breast, but also lift them and make them more perky. And so what it does is it pulls the skin envelope together and points out the breast, which is really not what we're trying to achieve in transmasculine patients. And I don't think many of my patients would thank me if I left them with lifted but smaller breasts. So I do certainly use the inverted T or the anchor procedure all the time, but that would be the first reason I don't do it in transmasculine patients, because we want to get the contour right. The second reason we don't do it is it's always a good idea, obviously, to hide your scar if you can. So with the one horizontal scar, sometimes it has to go all the way across the chest in a larger patient, or the double incision. We always strive to hide that underneath the insertion of the pec. So that fold underneath the pec muscle is really where we want to try and land that scar. It's not always possible depending on the patient's anatomy, but that's certainly what we're trying to do. But if you can imagine, if you now have a vertical scar sitting in the middle of that chest, there's no hiding for that scar, and why would you do it? We've masculinized some chests and, taken some huge breasts off, and never once have I had to use the inverted T procedure. Now, having said that, obviously, if that's what your surgeon prefers, discuss it with the individual surgeon, look at their before and afters and see, are they acceptable to you? But the majority of surgeons who specialize in this type of surgery would not be using the inverted T in order to undergo masculinization of the chest. I hope this is helpful.